we thank you for registering to join this very exciting community-led models of innovation. And this is from Frontline AIDS partners across. I'm going to ask Revati just to do the welcome and hello. Then I'll do a housekeeping slide, and then we will do the purpose and the objectives. Over to you, Revati.
Thank you, Colleen, and welcome everybody. I hope you're enjoying, if you're in England, I hope you're enjoying the summer weather. If you're in South Africa or in the Southern Hemisphere, it's probably winter there for you. But I hope you're all well wherever you are. I know Colleen hasn't been too well. Get well soon, Colleen. So as you know, on behalf of Frontline AIDS and partners, I welcome you all to this webinar. We've had a series of webinars focused around the theme of innovation. And as you know, Frontline AIDS and partners, we have a global plan of action. And in that action, we have outlined 6 areas where we want to focus on. And innovation is one of the core areas that we focus on. So within innovation, there's lots of things to talk about within innovation. But our partners in South Africa, NACOSA, they lead the innovation action on behalf of the entire partnership. So what that means is that they convene our partnership and support us in the sharing of knowledge around innovations. So this is very important to say. And also, it is our last webinar on innovation because actually the Global Plan of Action ends this year. And we are now at a phase of actually winding down the Global Plan of Action. And we've started to develop our new strategy. And I know many of you have been involved in that as well. So thank you for your efforts on that. So it is going to be our last webinar on innovation. Then the other thing to say is the previous webinars have all been recorded. So they are available, should you wish to have a listen to. Sometimes I like to listen to webinars after they've happened because then I can speed it up a little bit, and save time that way. So I think this webinar will also be recorded. So please feel free to continue to share this with your partners and your networks. So today we will listen to our partners speak about community-led innovations. And we'll hear from across the globe, really a very wide array of partners from Kenya, from South Africa, from Lebanon, and even from Ecuador. So this will be something very exciting to listen to. So please welcome, and let's hear from our colleagues. Thank you, Colleen.
Thank you so much, Revati. Thank you, Revati. We appreciate your leadership on this action as well. And so as Revati said, you're all welcomed. Raymond from my project, I see your camera is on, but you were walking. I don't know if you want to put it off, Raymond, it's up to you. So I'm just going to share this one slide before we get into the purpose and objectives. Just to say that we've got the webinar in 4 languages, in English, Portuguese, French, or Spanish. So if you go down on your screen at the bottom where you see the More button, you can click on there and you can select the language of your choice. So when you're comfortable, we've got the interpreters in the different rooms ready to speak and to interpret. So please select the language of your choice. Thank you so much. Just to talk about the agenda briefly. So as you can see, we've done the welcome. I'm just going to cover the agenda overview and some housekeeping rules. And then Revati will cover the opening remarks she has, and she'll cover the purpose and the objectives. And then Marina will give us an overview or an outline of the Frontline AIDS Innovation Hub. She'll take us to the hub and show us. And so then you're welcome to go there afterwards. Then, sorry, we're going to hear from 4 of our partners, our global partners. We're going to hear from Dr. Andrea in Ecuador on integrating anal cancer prevention. We're going to hear from Manal Tika in Lebanon on the e-learning course for police officers. We're going to hear from Nathanael from Blydenstein in South Africa on the school-based safe spaces to empower adolescent girls and young women. And then we're going to hear from Patriciah from Kenya on the Mind Skills program, which is a sports-based mental health project. And then we're going to wrap up with a Mentimeter, which Marina will lead us through, and she'll show our responses on the screen. And then Revati will do the closing and the thanks. And I'm excited to see David here as well. So David, if you stay till the very end, we can hear your thanks as well to everybody. So that's it. Just to add around the housekeeping, keep your mic on mute if you don't mind. Put your questions in the chat, and the speakers will pick up the questions and they'll answer. Because it's only 1 hour, we don't have a Q&A slot. We've tried to accommodate as many innovations for sharing. The information is on the site that Marina will share with us as well. And you're very welcome to go to the site, look at the innovations, reach out to the relevant colleagues, or like I said, put your questions on the chat. That's it from me for the rest of the time. I'm going to move the slides along. So I'm going to hand over to Revati now. Thanks.
Thank you, Colleen. I think I've already explained a little bit about why we are here and what we will discuss. But really the purpose, as I said, once again, is to showcase our community-led innovations within the Frontline AIDS partnership so that we could learn from each other and really inspire future models of serving the people we serve who are the most marginalized in society. So one of the objectives is, of course, to highlight innovative practices. Second is to foster engagement and collaboration, and then to promote sustainability and advocacy. So these are really the main objectives of the webinar. And it is about sharing, learning, listening, most importantly, and then looking at what can be adapted, scaled up for greater impact. That's kind of the whole, scalability framework within which we operate and innovate projects. So that's really where the purpose of the webinar. So thank you for that. Next slide, Colleen.
Marina will take over now. Marina, over to you.
Yes, can you all hear me?
Yes.
Great. My name is Marina. I'm an advisor at Frontline AIDS, and I've been working in the Innovation Action since 2020. And I'm sure that everyone knows what the Innovation Hub is, but just in case you don't know, here's a reminder. The Innovation Hub is a request that came from partners at the very beginning of this strategy. When we gathered and we asked partners to bring together abstracts of things they were piloting or testing, or they've already scaled up, and partners said, wouldn't it be great if there was a platform where all these abstract, all these projects were together, so we could all access and learn from one another. And this is what we did, and this is what the hub is. So the hub is just it's a page. It sits on the Frontline AIDS website, and it was started in 2021, and it has been updated every year, and it collects examples of community-led innovation from across the partnership. I just wanted to also actually show you the hub for anyone who might not have seen it. And just one thing that I always think people might forget is that the hub can be translated automatically to 143 languages, which is something that I'm not sure people know. But this is can you see my screen? Yeah.
Yes, we can.
Okay, so this is the Innovation Hub. There's a box here, and you can actually translate the hub to lots of languages. So my mother tongue is Catalan. I do translate it into Catalan, which is quite a small language, and it works. You can also translate it to Arabic, and it automatically it will translate the whole thing, and it would translate every single profile in there. So if you ever think, oh, the hub is all in English, so I can't really share it with my region or with my country or with the communities that I work with, that's not true. It can be translated. The other functions that the hub has is you can search by keyword, and then you can also filter by country, by region, by innovation stage, by thematic area, and by population group. So that's just a very, very quick tour of the hub. And then, of course, every time you click on an innovation, it will tell you a bit more about this. It will tell you the stage of innovation. It will summarize the interventions, the learnings, the next steps, and the sustainability. And sometimes there's also more information where you have actual links to the website, any evaluation that has been done, etc. So let me stop sharing, and I'll go back to the presentation. So this is the hub for anyone who might not know. Next slide, Colleen.
Are you still able to see the slides?
Yes.
Okay, good, thanks.
Okay, and I think because it's been 5 years, I just wanted to give a little summary of what the Hub has done so far. So far we have 90 innovative practices from across the Frontline AIDS Partnership documented in the Hub from 56 countries. And it really takes a lot of work to collect these examples and like edit them and put them in the Hub. So I want to say thank you to Ainoa and Nolu who did that job last year. And to say that these 90 practices that you have in the Hub, they really are the tip of the iceberg, because we receive so many other innovations, but sometimes, you know, we don't have evidence for them yet, or we don't have enough data, or they're not quite yet there. But just to say that if we have collected 90 innovative practices from all the partnership, means that there's so many more. You know, this is literally just the tip of the iceberg. The Hub has also been incorporated into new projects and proposals in these 5 years as a knowledge management tool, and it has been the source of these Action for webinars. So we've sometimes collected and put them thematically, like climate change or digital health. The one we're doing today is like different topics, because we had an array of projects with different topics. So that's what we're presenting. And then what can you do for the Hub? So you can, of course, check it out and you can connect with partners that you want to learn from. This is the ultimate goal of the Hub, that we all learn from one another. You can also mention it on social media. For example, this year, the comms team made a really good campaign in April called Spotlighting the Innovation Hub. So we created case studies for each of the innovations of this year. And you can also encourage your organizations to send profiles annually and to be part of the selection committee. So that's a bit about the Hub. And I think now we can start. And our first speaker is Andrea.
Thank you, Marina. I will be presenting. I'm Andrea, and I will be presenting in English, in Spanish, sorry, so you can follow the interpretation. Soy Andrea Cevallos, soy parte del equipo técnico de Kimirina, una organización comunitaria de Ecuador en Latinoamérica. Y voy a presentar sobre el programa de salud anal y cómo integrar la prevención del cáncer anal en la respuesta al VIH. Next slide, please. Entonces, el programa de salud anal inició en diciembre del 2022. Vamos un poco más de 2 años con el programa. Y se decidió iniciar esta innovación dado que sabemos que la incidencia de cáncer anal es más alta en ciertos grupos de poblaciones claves y que no estaba siendo atendido. En Ecuador y en Latinoamérica no existen datos sobre la prevalencia o la incidencia de cáncer anal, ni a nivel en la población general, tampoco en las poblaciones claves. Pero la literatura nos dice que las personas que viven con VIH o los hombres que tienen sexo con hombres, también mujeres que ya tienen antecedentes de la infección por papilomavirus a nivel genital, tienen mucho mayor riesgo de cáncer anal. Y no existe ese servicio de prevención de cáncer anal, ni tamizaje, ni una política de prevención y promoción, por ejemplo, tampoco para el uso de la vacunación en estos grupos a nivel del sistema de salud público, por lo que Kimirina decidió iniciar el programa. Hay todavía mucho estigma sobre la salud anal, tanto en los equipos de salud, pero también en las propias poblaciones, un autoestigma y no buscan este servicio, no buscan hablar tampoco con sus equipos de salud sobre problemas a nivel anal. Lo que quiso hacer Kimirina es integrar la salud anal dentro de toda la estrategia de prevención combinada para el VIH, siempre con un enfoque centrado en las personas y desde un punto de vista comunitario. The next slide, please. Entonces, hubo dos grandes objetivos que se hizo. La una era tratar de identificar personas que ya tenían algún síntoma a nivel anal, como los que están ahí, sangrado, dolor o verrugas o alguna masa en la región del ano, y que estas personas puedan ser atendidas en los centros comunitarios y no tengan que esperar meses y meses hasta que puedan ver un proctólogo en el sistema de salud público, como usualmente pasaba. Entonces, eran las personas que ya tenían algún síntoma, que probablemente ya tenían alguna patología o algún que sea benigna o una lesión premaligna de cáncer anal. Pero también en las personas que no tenían síntomas, hicimos una campaña como para hablar sobre salud anal y que puedan tener prácticas sexuales que sean seguras y también placenteras. Entonces, cómo hacer la preparación para el sexo anal, qué se recomendaba hacer, qué no se recomendaba. Y sobre muchos mitos que podrían haber en la población. The next slide, please. Entonces, con estos dos objetivos, tanto de en las personas que ya tenían síntomas, identificar qué enfermedad podrían tener y tratarla a tiempo y prevenir, hicimos formaciones con nuestros socios también regionales. em, Vinieron médicos expertos a formarnos de cómo hacer la evaluación anal, técnicas que podían hacerse en el consultorio, en los centros comunitarios y no como se hacía previamente y se hace todavía en el sistema público, en el quirófano, en los hospitales grandes, sino podíamos resolver las lesiones premalignas, las verrugas, los condilomas en el consultorio, sin anestesia, ese mismo día y con personal de nuestros centros que están sensibilizados con la población y con la población clave. Entonces, la primera foto es una de las formaciones que se organizó para formar a los médicos de atención comunitaria. Y por el otro lado, en la segunda foto también hicimos talleres tanto con los promotores de salud, los brigadistas, para que puedan tener más conocimiento sobre esto, sobre las prácticas sexuales anales, cómo evitar los riesgos, hacer reducción de daños en el caso de uso de drogas, por ejemplo. También fueron formados entonces todos los brigadistas y también hicimos estas charlas con autoridades o otros actores del sistema de salud, también como para incidir políticamente sobre la necesidad de la vacunación del HPV para la población clave y sobre la necesidad de estos servicios a nivel también del sistema público. The next slide, please, Colleen. Entonces, bueno, más fotos sobre estos talleres que se organizaron, donde ven ahí los brigadistas pares, que son los que van a los sitios de encuentro fuera del centro comunitario y donde ya tenían como más herramientas para hablar sobre la prevención del cáncer anal, promocionar la salud anal y también identificar personas que podían tener ya un síntoma para enviarles y referirles al centro comunitario de Kimirina para que puedan ser evaluados. También hicimos un convenio para que también participen en estas formaciones el personal del Ministerio de Salud, que también puedan formarse ellos. Igual se hicieron talleres vivenciales de cómo podrían abordar a los usuarios, qué diálogos tenían que usar, un pequeño speech. Yes. Sí, the next slide. En esta foto, en la primera, ven al médico de Kimirina, los médicos de Kimirina igual formándose de hacer estos procedimientos para resolución de las verrugas o condilomas a nivel del canal anal, que como decía antes eran procedimientos que solo se hacían a nivel de quirófano en un hospital y que tardaban muchísimos meses los usuarios en tener una cita para este procedimiento. Ahora en Kimirina los hacemos en el consultorio, solo con anestesia local y con instrumental que solo tenemos en Kimirina, que fue traído de nuestros socios de Coalición Plus de Francia y por los que fuimos formados. Y también hicimos charlas en el hospital público para que sepan que pueden enviar a sus usuarios, sus pacientes desde el hospital y que estaban esperando largas listas de espera hacia el centro comunitario de Kimirina para que puedan ser resueltos sus patologías mucho más rápido. Siempre con el enfoque de la prevención de VIH y otras ITS y haciendo la estrategia combinada, ¿no? The next, please. Entonces, como resultados, hasta ahora en este programa se han formado más de 8 médicos en la red de Latinoamérica de Coalición Plus. A nivel de Kimirina hay más de 20 educadores pares o brigadistas que han sido formados para tener este abordaje comunitario sobre el sexo anal seguro y placentero. Em, se pregunta en todas las consultas, inclusive de prevención, como de PrEP o de cualquier consulta médica que pueda tener el centro comunitario, se les pregunta a los usuarios sobre la presencia de síntomas a nivel anal y en caso de que tengan, se les recomienda que se les realice una consulta de salud anal. Hemos tenido desde enero hasta ahora, en estos 6 meses, más de 200 consultas de salud anal en Kimirina, en las 2 ciudades principales. Y esto, como les dije, ha permitido que haya una resolución de las patologías a nivel comunitario, mucho más sensible, también mucho más costo efectivo, antes de que tengan que ser enviadas a los niveles hospitalarios. Eso sería todo. Muchas gracias.
Thank you, Andrea. Next, we'll hand over to our colleagues in Lebanon. Manala. Thank you.
Hi, everyone. Okay, just one second. Okay, so I'm going to be presenting an innovative approach that was developed and implemented by SIDC. But first, let me just tell you a little bit about SIDC, Society for Inclusion and Development in Communities and Care for All. We are a non-governmental organization in Lebanon, established in 1987 and registered in 1992. Our vision is to ensure that vulnerable population enjoy their human rights in general and fulfill their potentials without stigma and discrimination. And our mission is to engage the vulnerable population to promote their own health and well-being in regards to HIV, harm reduction, sexual reproductive health, and mental health, and to support them enjoy their human rights and gender rights. We work on 7 different pillars, strategic axis. Please, second slide. The strategic axis that we work on are advocacy for human rights, protection and care services, direct services for and vulnerable population, mental health and psycho support services, reduction of stigma and discrimination, meaningful engagement of vulnerable population, harm reduction services, and sexual and reproductive health. When we talk about ISF, we're talking about internal security forces in Lebanon, on advocacy level. Why are we working with internal security forces? SIDC has been documenting human rights violations since years till now, and a decent number of violations were reported to be done by ISF members. So that's why it came to the idea to do capacity building trainings, and SIDC has been providing training to ISF since 2013. However, in January 2022, SIDC started developing the SOP for standard operation procedures for internal security forces on how to work or how to behave or treat the key population when it comes to arrest and detention. After this SOP was validated in late 2023, and in early 2024, early 2024, SIDC developed the training module that contain all the information, including all the all the HIV, STIs, drugs, all the subjects that we work on, including the SOP that was developed. And back in late 2023, a TOT training was provided to 3 ISF members, who in their turn provided this capacity building to another 18 security forces. When we had the SOP and we had the TOT conducted, and now we have a core group of ISF members helping us to disseminate and validate this information, especially after the formal validation from the ISF Academy. Then we started looking on innovative approach to how to disseminate more, to reach out to more ISF members, not only to stop on capacity building. We're going to continue the in-person capacity building. However, we need to reach for more people, to equip participants with more information on HIV, STIs, others, and to ensure that we are targeting more people so we can reduce the discriminatory and stigmatizing approaches that were being documented. And on the other side, it's an opportunity to strengthen the communication between ISF and SIDC at the same time. So that's why we did develop the e-learning course, which includes topics on 10 specific courses. These courses, you can go ahead with the other slides. This course has 10 topics. It starts with in-person session. This in-person session, we do an objective, what they are going to learn in these e-learning course, how the pace would be, how they can use the course, and all the other information, including a self-care session for members. The training is going to be on separate every 25 ISF members doing this training separately. It will be followed by 2-week space to to take the e-learning course on their own self-pace on Moodle, using the Moodle platform, and then aiming to end of October 2025 to do the ceremony for graduation for all the target ISF members. We're aiming to target around 180 ISF members. Considering that, noting on the side that we already did the first group of members, it was very interesting, the engagement of the members. And what we noticed, that sometimes stigma and discrimination are being presented in the field and are being documented, because the one who's doing the stigma and the discrimination, they don't know enough information, they lack the awareness, and when they do have the information, they changed their concepts, which were noticed today on one of the trainings that were conducted. By the end, this training will be hosted on Moodle, or is hosted on Moodle currently. It contains different quizzes, it contains videos, case scenarios, case studies, and there's one of the ISF officers beside one from SIDC team is dedicated to provide technical support for any ISF member who needs support technically through the app, through the Moodle app, like 24/7. And we're looking toward seeing an impact after like several months, especially is that it won't be only the e-learning course. However, there are going to be follow-ups with the people who are taking the course. We will be monitoring their engagement. We're going to analyze the how much time they spent on the course, how much time they do the test, how many times they do the test, or how many sessions needed, if we need to offer more refresher sessions. So it's the stepping stone to a larger scale engagement and larger scale communication with the ISF, which put us on different level while working with the government on terms of capacity building and advocacy. Thank you. That's it for me.
Many thanks, SIDC. We appreciate you sharing on your e-learning course. Next up is NACOSA in South Africa. Over to you, Nate.
Good afternoon, everyone. I'm Nate van Blydenstein, and today I'm sharing some of the design principles of healing architecture, youth agency, and programmatic insights that went into developing school-based safe spaces to empower adolescent girls and young women and improve access, uptake, and adherence to health-seeking behaviors. AGYW are more likely to access and return to services in spaces where they feel respected, where they experience continuity and routine, and where they trust in the space and the service providers. The school-based safe space is a dedicated space where AGYW feel physically and emotionally safe, free from trauma, excessive stress, violence, and fear. These spaces offer routine access to SRH services, psychosocial support, peer connection, skill building, and the right to play, rest, and recreation. Next slide, please. Okay, so the next two slides will show you our original concept and then show you its implementation. What you see is that the infrastructure includes a welcome outside space that is shaded and can function as a multi-purpose activity space. And whilst it's still clearly attached to the clinical and psychosocial support areas of the safe space. The shade structures are typically made from gum poles and wooden slats made of invasive trees. And the safe space building structure can either be made from a converted shipping container or a prefab structure or a retrofitted classroom. Next slide, please. For example, here's what we call a prefab safe space. So you can see that there is a shade structure at the front, which then leads into an administrative space, and clients can exit from the administrative space to the back of the safe space where they can either access the games room or they can access the clinical room as needed. And you can see the flow of how that works in this picture. Next slide, please. So this slide talks to the design principle called the psychobiology of space. So stress-reducing environments improve self-regulation, reduce cortisol levels, and improve access of health services. As shown in the previous slide, small design considerations, such as privacy thresholds, can be a key differentiator and emotional buffer that can help normalize uptake of SRH services in schools, like HIV testing, PrEP, contraceptives, or even social work access. Next slide, please. This design principle is called the teleology of space. And so healing spaces must aspire to consistently reflect the purposes that they serve. In this sense, the design considerations are not passive. The safe space must activate agency, layered programming, and dialogue. For example, the flow between the inside and the outside that we looked at earlier encourages discovery, play, and voluntary service uptake. A round table in the games room and counseling room enables peer education and empowerment, and a warm and inviting clinical removes shame from the client and nurse interaction. You can go to the next slide, please. This slide speaks to a rather difficult word to say, but it's called the salutogenesis of space. And here we look at how design must go beyond treating disease and should aspire to generate health-seeking behavior. So when learners co-create artwork or culturally relevant murals in the safe space or motif posters, they feel that co-ownership of the space, and that emotional connection and continuity supports the empowerment of young women to successfully self-advocate as their health needs change and evolve over time. Next slide, please. And I'd like to leave you with, I think, a really important summation of how we should think about design, which comes from Francis Kere, who won the Pritzker Prize, which is the highest prize in architecture. He says that it's not because you are poor that you should not try to create quality. Everybody deserves quality. Everybody deserves luxury. Everybody deserves comfort. We are all interlinked, and concerns in climate, democracy, and scarcity are concerns for us all. And this is the design principle that we've built upon. It's designed not just a luxury, it's a statement of dignity, agency, aspiration, and economic justice. Thank you very much.
Thank you, Nat. That was excellent. I'd like to know if Patricia is on the call. Patricia, we can hand over to you for LVCT out of Kenya. Or anybody from the Kenyan Mind Skills Group.
Hello, I hope I can be heard.
Yes, thank you.
Great. Thank you very much. My name is Anthony. Patricia is also on the call together with other colleagues of mine. I'll be presenting on behalf of LVCT Health. I just want you to stick on this slide for a few seconds as I explain this program. This slide that you see here summarizes the program that I want to talk about. We call it Mind Skills, and Mind Skills is basically basically sport-based adolescent mental health program. And on the photo that you can see a photo of young people there, children. You can see a photo of a soccer ball, and this basically summarizes the program. Next slide. So what is Mind Skills and how does Mind Skills work? What does it do and where do we work in the program? So in my previous slide, Mind Skills is a mental health program that is specifically developed for adolescents, and adolescents in our definition and the definition for this particular program is young people who are between the ages of 10 years to 19 years, categorized into two. We have 10 to 14 years and then 15 to 19 years. This program is developed by Grassroots Soccer and it's implemented by LVCT Health in Kenya in 2 counties. In Kenya, we have 47 counties. We are implementing in 2 counties at the coastal part of the country, Mombasa, and the Kenyan capital, Nairobi. So what does it do? First, Mind Skills builds coping skills and helps adolescents and young people to be able to cope with issues like depression, emotional regulation, and issues of substance misuse. It also increases access to mental health services where young people are referred to access services regarding mental health and reduces stigma by information giving and breaking down issues around stigma around mental health. So how does it work? We use positive approach to address sensitive topics that are not traditionally addressed with regards to mental health. We use also community-based programs to engage young people in conversations that are around mental health. And of course, as I mentioned earlier, we utilize sport-based interactions with young people to be able to disseminate that information to them. And of course, we are currently implementing in 2 counties in Kenya, at the coastal part of Kenya called Mombasa and Kenyan capital, Nairobi. Next. Here's a summary of the program and how it works. Mind Skills is a 10 structured program, 10 session structured program where 2 peer educators, in our context, we call them coaches because they are mentors to these young people. As I mentioned, they are between the ages of 10 to 19 years. They provide mentorship through structured sessions. There are 10 sessions in number, and they are conducted either in school or community levels. We have partnered with the government, county governments, to be able to conduct this particular program, in particular Department of Health, under the school health and mental health units. We have utilized the national data warehouse and collection to be able to collect data for this particular program. And we deliver it in different models. We have a model called Gold Standard, where it's an in-person program where coaches and young people meet in person and they're able to deliver those sessions. We have magazine only, and I'll be able to talk about that magazine, where the adolescents are given magazine to be able, as a take-home resource, to be able to read through and understand the issues of mental health. We also have situations where there is only an event that has one-off. We are able to provide the program in that particular event. And we also support our coaches by providing coach development through debriefing and one-on-one sessions. As you know, as I mentioned, the coaches are peer mentors who support in the program implementation. And since this is a mental health program, it is important that we also take care of their mental health. And therefore, we have coach development sessions. We held our first Adolescent Mental Health Summit in 2024, and we are looking forward to hold the second Child and Adolescent Mental Health Summit this year in September. This program also has a disability inclusion component where all adolescents within the categories of 10 to 19 are all inclusive, and program is sensitive to their needs. The next. So what next for the program? As I mentioned, we are planning for Adolescent and Child and Adolescent Mental Health Summit, which will bring together stakeholders and players in adolescent mental health to be able to talk about issues of policy, issues of access to services around mental health in September. And this summit is open to people who are even from other countries as well. We are increasing our reach to adolescents who are vulnerable, such as those living with HIV. We have teen mothers, adolescents with disabilities, OVCs, all those, including those in conflict with the law, to be able to benefit from the program. And we continuously work together with the government to be able to reach out to these adolescents. As I mentioned, a coach or the person who implements the program is very important to us, and therefore we've continued to provide mentorship and professional development for the coaches. We're also looking forward for partnership and collaborations with institutions and other implementing partners to be able to continuously provide this particular program. Next. These are just resources for the Mind Skills program. I talked about disability inclusion. We have a disability inclusion handbook where our coaches are able to reference and get information and guide on how to deliver the program using the handbook. We have our takeaway Mind Skills magazine, and of course, Mindset magazine guide on to be able to give coaches guide on how to implement a one-off event. And lastly, there we have the coaches guide. This is some sort of a curriculum that supports our adolescents, our peer educators to use the resource to be able to implement the program effectively to young people. Thank you very much. Next. This is just acknowledgement of our partners from the funders to the counties and the implementing partner, which is LVCT Health. Thank you. I think at this point, it's safe to say asanteni sana.
Thank you, Anthony, and the colleagues at LVCT Health. We appreciate that. We would like to thank all our partners for sharing the innovations. And just to remind you, on the innovation site, the one that Marina showed, maybe Marina, you can just put the link back in the chat again. You are welcome to go find all of these innovations and so many more on the Frontline AIDS innovation site. Please go look, engage with the speakers, and yeah, let's not let it just sit in a webinar. I'm going to hand over to Marina to take us through the Mentimeter, and you can take over the sharing if you want, Marina.
Great. Yes, so we'll just do a very quick Mentimeter. And if you don't know, you can Google just menti.com, and then you'll need to put a code, which is this one, 21493809. So let's see. It's just 4 questions, and I think it will just help us also close a bit the action in this webinar. Can you see my screen? Yeah. Oops, that's the wrong question. Correct. Great. So I don't know how are your digital skills, but maybe someone is already there. The first question is, did you learn something new in this webinar? And did it spark any ideas for your own organization? And it's just for us to get an idea. So we've heard about anal health and how it can be brought down to the community level. We've heard about training police through an e-learning course and also sort of continued engagement to reduce stigma and discrimination for key populations. And we've heard about the spaces for in schools for young women. And then we've heard about this program for sports program for mental health for adolescents. Okay, great. So we have some yeses. It's a word class, so you can write whatever you want and it will come. So feel free to write. Okay. Cool.
Marina, you're able to share your screen for the word cloud that I can unshare.
I thought I was sharing my screen. No?
No. We're not seeing it.
Yes, we are seeing.
We can see. We can
are
see.
seeing
Colleen.
it.
Sorry,
We
it's
can
only
see the
Colleen.
word.
Okay.
I'll find it, sorry.
No worries. Okay, I think we got enough answers, so it seems like we've learned something. Great. The next one is, and we'll have to do some memory, and sorry, because, but have you been to any other innovation webinars in the past 5 years? And just to say, we've done about 4 webinars per year. So we've done FGS, we've done climate change, we've done digital health and AI, and I'm sure many more that I'm forgetting, but have you been to any other webinars in the past 5 years? Did they spark any new ideas? And did you turn any of them into practice, even if it's just a little step, like a little new idea, a little thing you added to another program? Okay, some first time, some no's, some yes. Okay, and if you turn them into a little step into another program you had, or you linked it with, or it just started a relationship with another partner that you hadn't spoken to before, we would consider that a yes, and that would be also good to know. Sparks, but we need a fire. That's a very good that's a very good thing. Yeah. Okay. First time. Where have you been for the past 5 years? Infrequent. Okay. Good. More AI and IMS, please. Okay. You can see we are 24 people, so I might just wait a bit more. Okay, next one. The question here is, would you say the Innovation Hub, which is this tool that we've built and we've been growing for like 5 years, is a useful tool for the Frontline AIDS partnership? And you can answer more than yes or no, you can just whatever thoughts come to your mind. Nice. Yeah, that's good. And also to say that the Innovation Hub is a learning platform for us to learn, but it's also like a presentation card for the whole partnership. If we present to a funder or a donor or anyone, you can say, this is this partnership, that it's innovating all across regions, populations, and here are 90 innovations that have been collected, curated, edited, and this is just the tip of the iceberg, because it takes so much to just collect things, but there's so much more happening. Okay, some good things, good critics. Yeah, needs a stronger strategy. Yes, suggest rotating hosting. Good. Nice. Go beyond one-off webinars. Nice. Build collaborations. Yeah. Needs more focus. Yeah. Okay, definitely. Great. Thank you. And the last one is any ideas on how to continue growing, developing, and promoting the hub? Things you'd like to see, and I will also take note of the ones that have already been said before. Stronger strategy. And I also want to say that even though it's hosted by Frontline AIDS, the selection committee, which is the people that decide what the innovations go in and also advise on the strategy, is open to all the partners. And we did open it to partners last year. We received 2 or 3 responses, but if people are interested to be more involved, it is actually open to partners to be part of the steering committee of the Innovation Hub. Okay. Nice. Yeah, so a bit of a comms work to do, more discussions, more participation, fewer presentation, mention it on conference, attract funding, yeah, promote it more, needs to scale up. Okay. Yeah. Great, so thank you so much. I think that gives us some food for thought, and there's 5 minutes left, so I'll give it to Revati to close us off. Let me stop sharing my screen.
Thanks, Marina. And maybe after Revati, I don't know if David also wants to have a last word. Thanks.
Thank you, Marina and colleagues. Thank you, Colleen, for hosting this webinar. As colleagues said, we've been hosting together with our partners, NACOSA, who have been convening the partnership around innovation for the last 5 years. We have actually hosted almost 20 webinars, with an average of 1 webinar every quarter, let's put it that way. And the Innovation Hub really is one of the tools that we've used to document and share innovations at different stage of their development. So if it is nascent or just ready to scale up, the Innovation Hub is a place where you can go and see what stage of innovation certain programs are at. So in that sense, it's quite useful. Of course, we also know that a lot of innovation takes place offline, face-to-face meetings. I'm reminded of a meeting in Nigeria between our colleagues in Nigeria and APH, and they were talking on the use of AI, and that led to, having a discussion on AI, and also led to having a webinar on AI and the use of AI tools to reach the most underserved population. So especially in areas of conflict or during times of war. So there's been so much learning really through having these innovation webinars. So I really appreciate NACOSA and particularly Colleen for really holding all of this together for us very persistently and consistently. So thank you to that, and to our interpreters, and of course to all our participants. We really hope we can continue, learning and growing together. The role of, sharing knowledge across the Frontline AIDS partnership is a very important one, and something we are committed to doing. So please, may I ask David to say a few words? Yes, please, if you don't mind, put your cameras on so we can see you all, since it's our last webinar. It would be also nice to just see everyone. So I know many of your names, but sometimes I don't know what you might look like. So it would be lovely.
There we go. See lots of faces. My camera is not coming on. Somebody doesn't like me. I've been disabled by the host. But let me just say a couple of words. One of thank you to a number of people who have really worked to keep the engine moving of our work around the Innovation Hub. Marina, who's on the screen there, Nolu, in particular, who have just been a driving force behind keeping the engine running on our Innovation Hub. And I know it's been a really practical tool for lots of colleagues in the partnership. So thank you to you, and a thank you to NACOSA for holding this space with us on behalf of the partnership. The last thing I wanted to say is many of you will know we've been working on our strategy as a partnership for the last few months, and I wanted to share a quotation from one of the partners in one of the regional workshops we are holding, where they said, basically, we're in a situation where all of the skills that we've learned, we have to relearn them. With the situation that we're facing, with the funding crisis, with the there are so many things that we have to relearn. And she said, wouldn't it be great if when I learn it, you learn it? And when it's learned in Namibia, it's learned in India. And I think that's our challenge, really, as a partnership, is to create a space where learning flows across the partnership like electricity to where it's needed most, and from the amazing resource and skills that we hold at the front line of the HIV response. So often we wait for innovations and great new products to come from Geneva or to come from Washington in the shape of a new injection. But actually the most important innovations, I think, are really incubated in laboratories in community level. And that's been the heart of what we're trying to do with the Innovation Hub. So I think let's hold that resource really carefully over the coming years, and use it wisely, because I think it's the greatest resource we have. Money can come and go, but that kind of knowledge of what works at a community level is everything. So let me just close there and thank everybody for being part of the webinar. Back to you, Colleen.
Thank you so much, David. John, we literally have 1 minute left. It's 15:59 in South Africa. Do you have a 1 minute closing?
You put me on the spot, Colleen, there. But yeah, I think doing this, building on the strengths of this kind of sharing, doing it more ambitiously, looking to reach out to more stakeholders is the direction of travel. As
Yeah.
David said, I think the dynamics are different, but the needs are there. We need to be at your service and we need to offer a quality service. So I think that's our aspiration, but thanks, Colleen, to you. We want to put partners at the center of this, and it's great that you're facilitating it. So let's go from strength to strength.
Yes. Thank you, colleagues. Thank you to the Frontline AIDS team for spearheading this, and thanks to all our speakers. We will share all the presentations, or the presentation, and anything else. And then again, just a reminder to go back to the website, and whatever you're looking for, just go play around there in your local language and you'll find it. Thanks all. Bye-bye.
Thanks,
Bye.
Colleen.
Thank you.
Bye.
Thanks, everyone.
Thanks, Colleen. Bye.
Thank you. Bye.